Mr. Herrera, about the construction issues. You know, we all know that there's been construction issues on the big four, Orlando, New Orleans, Denver, Tampa, or Las Vegas and all that. And particular issues here, and I'm in my mind's thinking when we hear about the specialty scheduling, once you're moved, and that's part of the problem, no one's really sure what you're going to move. Dates have changed and so on. Now they're saying early next year at this time, early 2015 perhaps. But once you're moved, do you foresee specialty issues improving? It's the scheduling of specialty.
Yeah, so if everybody doesn't know, the latest date for the contractor to complete the facility is December 5th, 2013. So that's when it's completed. 2014, sorry. This year. Good. So that's when they hand the keys over. So once we get the keys, then the VA has to go in there and we have to install furniture, install equipment, et cetera, et cetera, et cetera. So there's a lot of stuff that needs to happen. So from December to out to about 120 days, the goal is to get everything installed and get our current operations that we currently have moved into the new facility. After that 120 days, the next phase, phase 2, will be to start expanding. So areas that are going to expand will start expanding. And then after that phase is completed, the last phase is to add services that we don't currently have at VA Orlando, like inpatient and emergency room.
Are you going to have an ICU with that?
Yes. So we'll be adding those. And yes, services will expand. And you know, with the ortho issues, you know, some of the problems we're facing now is at Lake Baldwin, you guys all in there, you know what the parking's like. So inside the building, it's the same way. There is no space. And so if, you know, even if we did hire additional orthopedic surgeons, there's only so many ORs that they can operate out of. So we're in a huge space crunch. So we can't just build a new OR. And so, you know, we're chomping at the bit to get into Lake Nona as well, because there's a lot more ORs. It opens up, gives us a lot more capacity.
How many ORs in the new facility? We're scheduled.
12. I want to say 12. I think it's 12. Don't open that tomorrow.
Yeah, but that's fine. Yeah, and that's something we're all going to be sure of. We're accurate on our reporting information. You can help us with that. What about staffing with the new facility? Are you having any staffing issues?
No, so what we've been doing is, you know, we've been, in certain areas, we've been hiring the staff. So one of the things that we've done is we've brought on certain types of physicians that are hard to recruit. If we can get them, we get them. And so what we've been doing with them is we've been using them. We have some relationships with some of the local hospitals where you guys have probably heard about the hospital in a hospital. So we'll have a team of VA doctors, nurses, and whatever support staff they need within the private sector, so we can refer patients to that facility, and then they see our VA doc, which in turn is helping us because it's getting them training, getting them used to the system. But we haven't completely staffed up yet. That'll start happening later this calendar year, but it'll be fiscal year 2015.
Yeah, that's a thought.
But and then real quick to address your question
right.
on Lake Baldwin, what the disposition is going to be. You know, so the VA Orlando's goal is to keep Lake Baldwin. We'd like to have a primary clinic
right.
there. So, you know, we've been working with central office on trying to make that happen. Yeah. So right now, I haven't been one way or another. It's up in the air. There's a big discussion over, you know, the VA has formulas for calculating space based on workload. So if you run, you know, when we run the numbers and look at the numbers, there's definitely a need there to have Lake Baldwin and keep it open. And so, you know, so right now it's what it boils down to, I think, in my mind, is an argument over the space gap that we have. Yeah. So once you know, everybody can come together on that, I think a decision will be made on that.
If you're a service-connected veteran, then you're entitled to treatment at a VA facility for that service-connected condition. That's why you need to make sure you come and see me. If you're a non-service veteran, first, let me just say this too. My name's Alex Alexander. I'm the Orange County Service Officer. You guys all have to remember, this was a clinic. This was not a hospital. So priority systems were put in place. Any honorably discharged veteran is entitled to treatment at a VA facility when feasible. Lake Nona opens, you have a hospital. That's a completely different scenario than what we have today. Somebody has to make priorities. You were saying about it took however many months to get an appointment. You were saying 7 or 8 months to get your appointment. Well, it's a clinic, still. You can call it a VA medical center, but it's still a clinic. It's small, so they can only see so many people. To answer your question, if you're service connected with the chronic disability, absolutely the VA will enroll you and see you for treatment for that condition. Depending on your percentage, they may see you for anything and not charge you a copayment. TRICARE guy, okay? Did that answer your question?
Well, for those people that are not service disabled,
When they go to the hospital and you have a honorable discharge, absolutely, they will see you for treatment.
the only, I just want to get out the word to other people, right? I'm service disabled, so I don't have a problem.
And as Dennis points out, there's an income issue.
Yes, there is.
You know,
There's a
because
means
again, it's
test.
still basically a clinic. So if you have OHI, other health insurance like TRICARE, Medicare, it's only right that the VA tries to say, well, you know what, this guy doesn't have any other insurance, so I need to see him rather than you. They prioritize.